our media friends from our famous bus, so what I'm going to do, I'll take some questions from members of the public. I'll take some media questions, obviously, as well. There's a lady at the back. And the difficult questions will be answered by Andy Burnham. And the really difficult ones by Liz Kendall. Right. Yeah.
Morning, thank you. My name's Karen Smales. I'm from Unison.
Hi, Karen.
But I also work in Leeds Community Healthcare. Andy, this is a question for you.
Excellent.
And if you don't give us the right answer, we'll get you next week. In Leeds, we've seen massive reorganisation of our community services. We've seen staff being downgraded and expected to deliver the same and more work on lower pay. What will you do when you become the Health Minister to reinstate NHS workers' pay and bring it back to real terms and real standard of living?
Okay. Sorry. No, sorry. I'm going to take another couple of questions, then I'll come to Andy. There's a lady over here, yeah, and then the lady here.
Thank you. I'm Susie Shepherd. I'm actually the chair of Leeds Occupational Health Advisory Service.
Great. Well, thank you for being here,
Labour candidate for Guiseley and Rawdon.
Great.
I'm actually concerned about the working lives of staff, and over the years we've seen many things like the Improving Working Lives programme, occupational health services and counselling services to staff disappear, and many of those staff now under this government have actually been retired out, whereas they should have received reasonable adjustments and been supported to train our new staff that are coming through the system. I'd like to see the Labour government actually use those skills and look at the people who are out there in the community who desperately want to put something back into the NHS and bring our youth forward to work in the NHS. How would you feel that sits with your proposals, Andy?
Okay, thank you for your question. And then there's a lady, well, there's actually two ladies next to each other, and I'll take both of you, and then we'll have time for more rounds. So, yeah.
Hiya, my name is Anna. I'm a mental health service user in Leeds. I'm also a rep for adult social care. And I also help run a social group for people in Leeds with mental health problems. So you can see where I'm going with this. Given that 1 in 4 adults and 1 in 10 children will suffer from mental health problems at some point in their life, and it's the biggest source of disability in the UK, and mental health accounts for 28% of morbidity, but spending on mental health is only 13% of the NHS expenditure. And it costs a lot in terms of treatment, loss of earnings and welfare. It's approximately £105 billion per year. And I keep hearing this term, parity of esteem, where mental health will be brought in line with physical health, and that we will get access to treatments and not have to have really long waiting times, especially when people are in, times of crisis. So my question, it's not a question really, is that, will we actually see this parity of esteem, and will, these cuts to mental health services within the NHS actually stop?
Okay, thank you. And there's a question next to you.
Hi, my name's Isla Dowds. I work in a local acute trust. I've worked in various parts of the NHS. I first started working in the NHS under the last Labour government, and my area of specialty is patient experience and patient public involvement. And at that time I saw real commitment from the government coming down to people in trusts and in primary care trusts at that time to really work at meaningful involvement of patients and the public in order to produce better services, improve design, improve access and so on. In the last 2 years, I've seen that really deteriorate. There's a non-existent budget now for the work that I do, and what little money we do have, and a massive amount of my time, is spent on implementing the Friends and Family Test introduced by David Cameron. I wish I could say that I believed in it. If anybody was going to believe in something like that, it would be me, because that is my passion. But I see a massive amount of waste of time, resource and energy for virtually no benefit. And I'd like to know what the government would do with the Friends and Family Test.
Just on the last point, is that because it's box ticking, or what is the...
It's extremely superficial, it's statistically ridiculous, it's extremely hard to make anything of it, because we've now got thousands and thousands and thousands of people giving us feedback, which I welcome. but there's no resource to do anything with it.
Okay, Andy, do you want to have a go at some of those questions?
I will. Shall I start with Karen's question, because it was an excellent question. Because I know when I'm Health Secretary, hopefully in a few months' time, I will inherit a demoralised and shattered workforce. This government has traded on their goodwill. 5 years of pay freezes, really, it just can't go on as it is. And the kick in the teeth came, didn't it, as I think Ed said before, when they couldn't honour their commitment to staff in terms of the 1%. So this is all wrong. So we have said we'll restore the independent pay review body. That's the first thing that we'll do. Alongside a plan to bring on the new generation workforce. Of course, we need a workforce plan, which was something that Andrew Lansley never had. But beyond that, we just need to get the balance right here. The agencies have got a hold over the system right now, haven't they? We haven't been bringing enough nurses and midwives through training, and consequently, trusts are having to pay huge sums of money for agency staff. And how galling must it be for people in the audience who work for the NHS, where you're not even getting 1%, not even treated properly, when you see your organisations throwing all of this money out of the door at agencies. They've got this all completely wrong, and no wonder morale is rock bottom. And then they say they want a 7-day NHS, paid for by getting rid of the unsocial hours payment. Well, this is all wrong. They're driving NHS staff into the ground. And it tells me that they don't appreciate what you do. So we won't do that. We will respect the independent pay review body. We will always honour national pay terms and conditions as part of Agenda for Change. We will protect the unsocial hours payment because that is fair to staff. And we will rebuild a sense of common cause between NHS staff from all over the NHS to bring back the morale and get NHS staff involved in building the NHS of the future.
Do you want to just deal with the occupational question, the second question that was asked?
Yeah, I mean, obviously, rather than just talking about doctors and nurses, we do need massively to improve our community services. I'm talking about one team around the person in their own home. And when I say that, I want you to understand what I mean by that. Yes, social care staff, yes, nurses working together, but also physios, occupational therapists, a whole team that are really there working to keep people out of hospital. And that's the way the system should work going forward. Highly coordinated and highly integrated. And it will mean investing too in those other health professions. And that's exactly what we will do.
Let me just, on the two other questions, on mental health, a really important question that you asked. I think we recognise that this is, if you like, the most unaddressed part of the health service that there is. And by the way, I'll say just incidentally that I think child and adolescent mental health is even the poor cousin of mental health generally. I'm not saying other mental health services are that great either, but I just meet lots of young people who often say, that's why we've made a commitment to raise the proportion of spending on child and adolescent mental health in particular. But also we did a report by Stephen O'Brien which looked at the kind of guarantees we need to make in relation to mental health services, and we've set those out, and we want to move towards a 28-day waiting time for talking therapies, and also put the right to mental health treatment in the NHS Constitution. Because at the moment you have a right to drug treatment in relation to the Constitution, but not in relation to talking therapies and other services. And it is by doing that, and this is the lesson of the NHS over the years, a bit like what happened in A&E when the 4-hour target came in, that is the way you drive resources towards mental health. I'll just make one other point though. Mental health services are not just a matter for the health service. It's what I implied earlier on. It's about teachers and schools. It's about businesses. There are some businesses who do a great job, but there's definitely more that can be done. I think it's about a whole range of areas where we need to do a lot better. On the question about public involvement, look, here's my just thought on this. I think everybody understands why the government felt motivated to introduce the friends and family test, given some of what we've seen has happened in the NHS. But look, the test of these things has got to be, do they work? And so, look, we will want to look at making sure it does work, but there's no point in having to bring things in and then just leading to frustration and not actually answering the questions that people are asking. So it seems to me you've got to make sure it works. We do want to make sure that there is proper patient feedback. I might add, I'm glad with what you said about the Labour government. I think this has always been quite a hard thing to get right, how you get patient and public involvement in the NHS right and how you get it done properly. But look, you've got to also work with the staff to make that happen. Yeah. I mean, do you want to add anything just on that point?
Only very, very briefly, Ed. I mean, Isla's right. I mean, we saw under this government an attempt to close Lewisham Hospital because of problems in a neighbouring hospital over the heads of people in Lewisham. And they fought back. And I would say they fought for every single person in this country, that community in Lewisham, and they took a stand and they were right to do it. And that's what it's come to. They're rushing through changes now, trying to close services without proper consultation. So we really are in the worst of all worlds at the moment. And Ed has spoken about true public involvement at local level, and that's what we'll bring. And if I could just say one thing about mental health, which I meant to add. There's a mum from Yorkshire, from Hull actually, who is leading a campaign at the moment to bring her daughter back home. Her daughter is over 100 miles away in Sheffield with very severe problems, mental health problems. But there is no Tier 4 provision in Hull. And she's leading a campaign to bring her daughter back. Now, how can it be that the most vulnerable children are getting the worst possible care, that there's cuts to that budget? That cannot be right, can it? And mental health has always been the poor relation of the NHS. But children's mental health services are the poor relation of the poor relation. It's so totally wrong. And Luciana Berger has done some fantastic work to show what's happening. We've got kids going up and down the motorways of this country on a Friday afternoon in search of a bed. That's what it's come to under this government. Those cuts to the mental health budget will stop. We will restore the provision that's needed in every community, and that too is what a 21st century NHS must be about.
Let me just briefly bring in Luciana Berger, who's our public health spokeswoman and also deals with mental health issues. So, Luciana, do you want to add a couple of words to what Andy said?
I mean, yeah, so one of the few things that's happened because of Labour Party's involvement from opposition is that we do have palliative esteem written into law. It was because of my colleagues in the House of Lords that we have that written into law. It is going to be up to a Labour government to deliver that. And we have done our very best to hold the government to account, where we've exposed the fact that we've seen hundreds of millions of pounds of cuts in mental health over the course of the past few years. We've seen a reduction in over 1,500 beds. We've seen hundreds of nurses go and hundreds of doctors too. It's not good enough. And it's absolutely right that we bring together mental health with physical health and along together with social care, so we are treating the whole person. And that we're absolutely committed as a party to tackling the stigma, because we've still got so much more to do. You're so brave to raise that question, because all too often we don't talk about it, but actually there's no reason why we should treat mental health any differently from physical health.
Definitely. Well done. Well done.
And we'll leave our coverage of that event, hosted by Ed Miliband, back with more news in just a moment.
Come to the lady over here. I promise the journalist I will come to you.
One thing that Bob said, all my life I've had more money than I could spend.